I'm a clinician researcher, so I spend half my time working looking after sick babies in the intensive care and the remainder of my time doing research around the care of those babies. Ellie's in a study that involves the follow-up of babies who have surgery in the newborn period. So there's a number of babies who have conditions which put them in hospital for a number of weeks and need operations early in life, and we don't know what impact that has on their brains. So we're following children to 2 years of age at least in the initial phase, to see how that impacts on their brain. And we're undertaking imaging, so MRI scans of their brains around the time of their surgery, so before and after their surgery. And we also do brainwave monitoring during the surgery and for a period afterwards to try and work out what impact the surgery and anaesthetic and intensive care has on their brain and development later on. We speak to families every day and we have to explain to them what will happen to their children down the track. And when it comes to some of these surgical conditions, we can tell them what happens to their chest or their abdomen and the areas that we're operating on, but at the moment we don't know what happens to their brain development, and that's what families really want to know, is what impact it will have on their children, whether they go to school down the track, what sort of impact it will have on their learning and behaviour, and they're the questions we're trying to answer for families. We're quite fortunate in this institution to be specialists in just looking after babies who need operations for birth defects. So it means we can really focus on the big issues for these particular patients. So we look at the conditions that require the highest impact surgery on the babies, and because we see so many of them, we're really interested in working out if there's a way we can improve their outcomes and perhaps intervene to protect their brains through this difficult time.